More and more standalone ERs are being built in neighborhoods across North Texas. They may look like urgent care centers, but there is a huge difference. And as I-Team investigator Ginger Allen tells us, if you're not careful, you could be in for a real sticker shock.
They seem to be popping up on every corner, places to go for medical care. But look closely. Can you tell the difference?
I should have looked at the sign.
Juliet Coulter learned the hard way.
You were in there for less than 1 hour?
Yes.
And this is your bill?
This is highway robbery.
The places are all convenient, but there are big differences in the care and the cost.
I don't want other people to be deceived by these places.
In January, Coulter was fighting what felt like the flu. In a hurry, she bypassed her regular physician and visited Highland Park Emergency Center in Dallas. Doctors gave her a breathing treatment, x-rays, flu swab, and prescriptions, all in about 45 minutes. That was great. But then the bill came, and that made her sick. The facility charged Coulter nearly $2,500 for treating her acute bronchitis.
I thought surely there must be one too many zeros.
Coulter is not alone. Bills from places like this are surprising many people, causing consumers to file complaints. Here's what you need to know. Take a look at this sign. This is a 24-hour emergency room. Now look at the bill. Coulter is charged more than $1,000 simply because this is a full-service ER. Devon Herrick is a health economist for the National Center for Policy Analysis.
That's precisely the reason that consumers and patients need to be aware of the difference.
Standalone ERs are full-service emergency centers with all of the same equipment and ability of hospitals, and you'll be paying for it. Herrick says only use them for serious conditions.
I guess maybe a good rule of thumb is there any risk of death? If I'm not likely to die, it may not be really an emergency. It may be just urgent care I need.
Urgent cares are typically for minor injuries, sprains, stitches, cuts, coughs. Probably a better choice for Coulter, who was fighting bronchitis. Lastly, you're seeing retail clinics inside some of the major chain stores. They're usually staffed by nurse practitioners or physician's assistants, typically treating strep throat, infections, and minor injuries.
You want to get the chips out?
Coulter called Highland Park ER and eventually got her bill reduced to about $1,500. But she says that's still too much.
If it's going to be more than a couple of $100s to get a couple of prescriptions written, then walk out and go down to the street. I mean, these places are everywhere.
Best advice, ask up front what it will cost. If you see ER anywhere in the name, expect to pay more and plan out where you'll go before you need it. Ginger Allen, CBS 11 News.
We contacted Highland Park ER for this story. They say they make it plain to all patients verbally and in writing that they are an ER and not an urgent care center.
But we try to give them as much information as we can, but I really think that a lot of the confusion lies in the fact that because we're outside of a hospital and we're not built onto a hospital, they don't think that we're truly an emergency room. And we are.
Lanza also says part of the problem is when people come to them, they're not feeling well, and so they may not be thinking about what it could cost for care.